Hi, Sejal. Good evening or good morning to you. How nice that you could
Thank
join. Are you able to hear me? Are you able to see me clearly?
Yes, I am.
Yeah.
Can you hear me okay?
Okay. Yes, I'm good. And I think a few of my friends are joining in. So, welcome everyone. So, this is Infant Massage Awareness Week, and today we are celebrating with Sejal. So, I'm going to say a few words about you, Sejal. So, Sejal is based in the US and she's very well known in the global birthing community as an IBCLC and certified infant massage educator. She's also a postpartum doula and she's certified in the tummy time method. So, a lot of my LC friends would be very familiar with you, Sejal, because of your wonderful lectures on the Gold Learning platform. And a few days ago, I was listening to your Babies in Common podcast where you're talking about infant massage. And you said something that really struck me. You said that skin is the brain on the outside. So, as a doctor, I know I've studied embryology and I know what you say is developmentally very accurate. But I was very curious to know why you said that in the context of infant massage, and that is why we have our live today. So, welcome.
Thank you.
Uh, okay. So, can you talk to us briefly, Sejal, about your journey in this field of infant massage, where you started and where you are at today?
Yeah, so currently I am traveling for work, but I started about 6 years ago um, as a lactation consultant and as a postpartum doula. It's been about 7.5 years.
Okay.
Infant massage kind of fell into my lap because, you know, I had massage before when I was in India, and
Hmm.
my cousins, when they were born, I was there, and my parents are physicians, so I have been seeing my mom's work with helping babies come earthside, so that influenced me. And it's like you start doing one thing when you are a child, and then you hop on to something else and eventually find a purpose. And I feel like I found my purpose in lactation and working
Hmm.
with their parents.
Hmm.
So
Wonderful.
journey, I knew about infant massage, but where I live here in America, it's a lot of the things that you do require certifications. So
Hmm.
um,
Hmm.
certified as an educator of infant massage. But a lot of it also comes from my own experience growing up as a child in India.
Yeah.
Eventually,
Yeah.
my aunt, when she delivered, she would come, and my mom and grandma would help her, and then we would
Hmm.
come and do the massage for her. And if nobody came, then either my mom or my grandmother would be massaging the baby, her.
Hmm.
And then
Hmm.
I had who came here to help
Okay.
me. So she's the one who taught me infant massage for my baby. And then she said, I'll do it for a week until you are kind of up and about, maybe a couple of weeks, and then you can start doing it. Because initially, as a new parent, everyone is kind of worried about how much pressure to
Yeah.
you, all of that.
Yes. Exactly. Yeah.
But my mom doing it so that I could trust that I can do it as well.
Hmm. Okay. So it's been quite a journey
Yes.
and a good marriage of your Indian roots and maybe the Western sensibilities. Yeah.
Yes.
So I'm just going to go straight into that particular sentence that wanted me to talk to you, which is the skin is the brain on the outside. So please explain, Seji.
So the reason I said that on that podcast, and I don't even remember a lot of the things that, since you asked me about it, that embryologically our brain and our skin are derived from the same embryological
Yeah.
layer, and our skin is constantly informing us about our surroundings.
Hmm.
And we use our skin organ to sense everything in the environment. We feel
Hmm.
through our skin, we
Yeah.
feel
Yeah.
pain, lots of, neurons and receptors are on our skin that inform our brain directly. So before
Mm-mm.
to the brain, the skin informs the brain. So that's why I said
Yeah.
the brain on the outside. And as a
Okay.
parent, you are massaging your baby, you are actually informing your brain about your baby.
Okay, so it works both ways. Yeah, right. Mm. Okay, so makes a lot of sense. All right. So, like you said, massage is an established tradition in India, and almost every family does it. But it's usually done to the baby, without too much regard as to what state they are in. Are they asleep? Are they crying? Are they even enjoying the process? So, when you talk of consent in infant massage, why do you think it's important? How do you ask a baby their consent? And how do you even understand whether they're saying yes or no? Just talk to us about this, Sejal, if you can.
Yeah, absolutely. So, it's interesting to me that when I started out, like as an educator here, one of the first things that was taught in that class was about asking the baby's permission. And
Hmm.
when I kind of thought about it, I was like, yeah, we never do that, And then
Yeah.
YouTube videos on baby massage. And some of them were like women who were not the parent of the baby, were,
Hmm.
the baby, and some of the babies
Yeah.
were crying and upset, and the massage
Hmm.
going on. And it made
Hmm.
me think that if I were the baby, would I enjoy this experience? And
Yeah.
I personally am a big fan of getting self. So I was able to verbalize, hey, can you use a little more pressure or a little less pressure, and tell my
Hmm.
that this is what I need. But
Hmm.
babies do that. The only way they
Yeah.
communicate is by either crying or, their facial expressions. They tell us a lot. So
Hmm. Hmm.
unless
Hmm.
parent, unless parent is doing that and seeing what their baby is showing them with their facial expressions, body language, there's a little flinch, or there's a little pullback from their leg, and all of those things that you see, there are subtle things that your babies are doing to let you know that, hey, can you back off on this one, or can you please continue doing what you're doing. And
Yeah. Yeah.
leg will, if you start with your leg massage,
Hmm.
their leg will just, kind of relax in your hands, and you'll feel that relaxation. Whereas when you're pulling, tugging on their leg to
Hmm.
get the massage done, it's not the
Hmm.
act of massage, it's how you are with your baby, right? So it
Yeah.
it is important that we understand that we are not just doing massage because we are told to do so by professionals. We are
Hmm.
doing so that we are learning about this completely new human that is a part of our life.
Hmm.
And
Yeah.
one of the I just recently I'm traveling to North Carolina, and one of the posters in my colleague's office says, "Babies are a good way to start people, or a nice way to start people."
Hmm.
And I was like,
Hmm.
if we want to start people who listen to us and who are compassionate and empathetic, we have to treat them that way when they start as babies. So it's
Hmm.
early beginnings that matter, and how they are treated matters. So if we start listening to our babies, and even if they don't talk, there is a lot of nonverbal communication that happens between a parent and a baby that we need to really, really hone in on. And yes, there are advantages to having someone come to your home and do a massage. Sure, it's a luxury, but who carried the baby for so long? The parent.
Yeah.
So your baby more than anybody else in the world, and
Mm-mm.
that's where you build your confidence as a parent, right? There is no guidebook on mothering. There are, but your baby is yours and yours only, and it's unique to you, just like you are
Mm.
a parent to them. So if we don't let parents do the things that we would like them to do, or they would like to do, sometimes they're afraid to ask that, hey, can I massage my baby? Or they're afraid to touch their babies. I hear a lot
Yeah.
of parents tell me that
Yes.
I want to support their head, and what if I hurt the baby? And that you carried this baby for however long you carried this baby, you did not hurt them now. So
Yeah.
again, it's building that self-efficacy in parents.
Mm.
It's very important, because
Mm.
once your hands have touched your baby and you are routinely doing these massages with your baby, they are constantly, communicating with you as they grow as well.
Mm.
They become
Mm.
teenagers. I have two teenagers, and sometimes the only way I get them to open up and talk to me is just giving them a little foot massage, and they'll just things. I mean, don't I hope they're not listening to this Instagram live, but one of the ways
Yeah.
that kind of get an in with your teenagers as well. So
Mm. Mm.
I say that continue, kind of exploring the relationship. If you don't explore
Mm.
to touch, a little harder understand.
Mm.
Like, we feel someone's um, emotion through the way they hug us, the way they shake
Yeah.
our hand, right?
Mm.
So that's why.
So it's a way, yeah. So it's a way of learning for the parent to learn about their babies. So what actually is the process of taking consent, Sejal, in infant massage? How do you go about it?
Right. So just like you don't, kind of you talk to your baby just like you would normally, and you would say, "Hey, we are going to do a massage," and you can pick a time like, where you feel the most calm, and you see that, oh, this is the time when my baby is calm and in this quiet
Mm.
state. And it doesn't have to be a very big window. It can be, it can start as a few minutes of massage, and then
Okay.
you
Okay.
those add up and become an hour of massage or half an hour of massage, depending on how the baby.
Mm.
And then if you feel that, okay, while I'm massaging, the baby kind of got hungry and I have to nurse the baby, then you stop and you nurse the baby, because we don't want to go through a massage keeping the baby hungry, because that's not going to end well.
Correct.
Either
Yeah.
one of
Yeah.
us going
Yeah.
to be upset and cry. So that is one way of saying, no, thank you. I do not want the massage
Yeah.
right. But most parents,
Correct.
because their baby cried during that first or second time that they offered massage,
Mm.
the
Mm.
baby don't like massage, and that's not the case.
Mm.
You
Mm.
you have to keep offering something multiple times before you will see that, okay, this baby really does not care for the massage. So you
Mm.
either back off on the pressure you're using, or you can change the environment, like make it a little warmer. Maybe it's too cold for them, because babies have to
Yeah.
regulate for temperature, and so depending on the age of your baby, you have to be mindful that, okay, what kind of a, I wouldn't want to get a massage in a cold room myself. I would
Mm.
a warm room. I would like low lights. That's how I like it. And
Mm.
I would try to kind of negotiate with the baby that, hey, are you happy in the morning with the massage, or afternoon, or evening?
Mm.
And that
Mm.
way the baby will tell you that, oh, you know what, I'm really fussy in the evening, so maybe massage is not a good idea, or it is a great idea.
Mm.
I calm down with the massage, right? So that is
All
one way,
right.
getting the consent. And then what we usually do when I teach parents is that, okay, you need to use your language, but you also need to use your hands, show them your hands and say, hey, it's massage time. So the tone of your voice matters a lot. You can't just say, I'm going to do it for you now. That's not how it works. It's like, let's make it an event where it's pleasurable to both parties, not just one.
Yeah. Yeah. Right.
Rubbing your hands. So then once you do this repeated kind of cueing, the brain is
Mm.
processing that information and saying, ooh, something and good is going to happen with me now. So I'm going to get a massage now. And my mom is showing my hands. And eventually, when they become like older, like 6, 7 months old, and you just kind of bring the bottle of oil, they will rub their hands like massage.
Yeah. Correct. So I think consent is not just asking for permission, but being attuned to what is happening through the process, like the time of the day, the pressure of the touch, and all that. Yeah. So if there's a parents who want to start infant massage, and they need to know about the kind of space they need to set up, or what time of the day to do it, what body part to start on, how long to massage, and can they do the same routine when the baby is older, what kind of oil to use. Can you just talk us through some of this, Sejal?
Right. So the oil that I usually suggest people use is something that is not very highly processed. Anything
Mm.
any seed-based oil that is cold pressed. Like,
Mm.
yeah, we use mustard seed oil during
Okay.
winters because it has a warming quality.
Mm.
And then we use sesame seed oil. So all of these oils, as long as they're cold pressed, they retain their nutritional qualities. So if I am teaching a baby massage class to a family that has a premature baby, I would
Mm.
say that let's pick some oils that are really high in that gamma linoleic acid, which is a very good fatty acid profile. So we are actually delivering to their skin organ. So
Yeah.
if we want to, kind of chunk the baby up faster with not just food, but delivering food through the skin, we must,
Mm.
they actually because they are not, they were not held in the womb for as long as a full term baby would be. They're born early, they need that kind of touch. So that is also touch nutrition, right? So we are not just providing a nutrition that goes through the mouth, but also through the skin. So any cold pressed oil will retain more of its nutritional value. The only thing is that they don't last. Their shelf life is not as long, but it's good because, we want it to be a shorter shelf life, but good nutrition value. It's like
Mm.
fresh food versus processed food. So
Yeah, exactly.
as long, processed food may last long, but it's not necessarily good for our body. So
Correct.
that is one of the things that, I mean, if it's available, great. So extra olive oil that is cold pressed.
Mm.
Uh, Nowadays they are making extra virgin coconut oil that,
Yes, correct.
so
Mm.
it depends on what oil is available in your area. I
Mm.
would do more research if you can. It, it depends on how much accessibility is there and what area you are in, right? So
Yeah,
I
yeah,
of when I suggest these fancy cold pressed oils, I want to be mindful that it's available in the area
yeah.
you are in.
Correct. True.
But don't use any
It,
the mineral oils that are, petroleum based products are not good for.
mm, mm,
So
mm, mm.
not to use would be adding any synthetic fragrance or parabens or any kind of
Yeah,
like strong chemicals. Your baby does not, because like Johnson, the company that markets their baby oil hugely all over, and it's not necessarily a good thing for infants.
yeah.
So
Correct.
yes, it smells great for you as an adult, but your baby has a very highly developed olfactory or a sense of smell, and you don't want to overwhelm that sense of smell with artificial smell. You want the smell of the parent to be there and not the essential oils or fragrance that has been added to that oil.
Mm, mm. Yeah, okay. And is there like a particular sequence that the parents do have to follow, like start with the feet always, or is that also cue based?
So it can be cue based most of the time. One thing I would kind of be aware or keep parents in mind is that we don't want to use a lot of pressure right away. Just because it's
Mm.
large, it may not be something that your baby may enjoy if you use too much pressure. Starting with the legs is a safe place, but for premature infants, if they have been poked in the heel multiple times
Yeah.
for any other screening, then they may be extra sensitive to their feet. So being aware that, okay, if my baby was born early and a lot of things were done to the face of the baby, if they had an NG tube or whatever, then you want to be mindful that, okay, they may be a little averse to that touch.
Mm. Mm.
But what you can do is to provide some gentle, just kind of cupping around the hands and then around the feet. And then eventually they will realize that not every touch is nauseous or painful, this touch is a good.
Exactly.
Starting with the legs and the feet is the first, like, to see a baby moving. When they relax, they mostly start with their legs moving,
Mm, correct.
go to the world with their legs. So if we can get the parents to just kind of be comfortable with, okay, let's kind of start with the lower legs and see how we go. And if the baby passes, then we take a break, we hug it out, and then we start over again. And there is no, like,
Mm,
yes, there are infant massage classes that I teach, and a lot of us teach, that have these, step by step things. But the most important thing to remember is the connection and the tuning to the basic station by the parent, not what I am exactly giving in a handout.
correct. Correct. Yeah. So there's no set script that they need to stick to. They just go by what the baby is directing them to do. Yeah.
Yeah. And if you think of the people who came and massaged babies, right?
Hmm.
To your home, and they don't have any formal certification,
Yeah.
them to touch your baby and handle your baby, and it just kind of, it's mind boggling to me that we don't trust the parent, and we have to, like, teach. I think most of the classes that we teach should be about building up that confidence, right, in the new parent, not necessarily instructing them. Although I
Correct.
am,
So,
right? But it's like being a teacher. If you're a teacher, you don't do the homework for the kid. You want the kid to
exactly.
learn and then do the homework on their own.
Mm. So, how would you build up the esteem of, say, a new parent who's even scared to hold their baby, let alone massage? They're afraid they'll, will I hurt his neck, or, will I cause him some kind of pain? So, what do you tell them actually?
So what I usually tell parents is that the more you touch your baby, the more confidence will come. So if you can touch one toe today, that's a.
Mm.
So we do baby steps. If a parent has extra anxiety over touching their babies, I would definitely say that, okay, let's start with just the toes.
Mm.
5 toes in each foot, and then go from there. And if you don't want to do that, just hold the bottom of the baby's, shin, behind the shin, and then see what happens. And
Mm.
they will see that, oh yeah, the baby is fine. So then they dare to go further. And so them to go step by step, and you have to actually understand that these parents only want the best for their babies. So
Exactly.
we have to, the confidence building will happen if we continue to work with them at the pace that they are at.
Mm.
So some parents will retain that information and will be like, I got this, and I'm gonna go do it at home. And some parents will be a little more wary. It also depends on the kind of people surrounding those parents. Like, if the family
Yes.
constantly doubting that, yeah, you're not
Mm.
job feeding your baby, you're not doing a good job holding it, you don't know this, you don't know that, it matters, the kind of
Yeah.
support are as a family, even the most well-wishing family members, including um, you know parents of the parent,
Yes.
who are there.
Yeah.
And one of the things to remember is that new parents, or new moms, or new birthing parents, are very, very fragile,
Mm.
just as fragile as their baby, not just
Mm.
body, but in their minds. And so when you
Yeah.
take something, a new parent,
Mm.
and it can have like an exponential effect on their mind, which is as
Exactly.
big, because you were never a parent before.
Mm.
So
True.
tell them,
Yeah.
like, if I'm a family member who is, let's say, my sister during her postpartum, then I have to be very careful what I say, even though I know a lot more about raising babies. Then
Hmm.
I don't have to prove it to her, or I don't have to say that. I am more experienced than you are, so hence you have to listen to what I say. You can say what
Hmm.
you want to say, but in a way where it's not, you know, shattering their confidence. And I have seen that happen.
Hmm.
Doula, that they'll say, "Oh no,
Yeah.
do this very well," and I'm like, "Yes, she does. Yes, she does." None of us did that, right? But also,
Yeah.
you have to kind of be mindful of your language we use.
Hmm. Hmm.
You trusted this,
Exactly.
carried a baby for 9 months. Why can't you trust her postpartum?
Correct, exactly. And unfortunately, that is so common where, just stray comments or when there's a baby in the house, everyone is an expert and they bring their stories in. So it's very difficult for the new parent. So, what you said was wonderful in the sense you have to hold space for the parent so that they can hold the baby. That's wonderful, really good.
Yes.
Okay, so what if this parent whose baby doesn't stool regularly?
Hmm.
She saw a video on tummy massage of YouTube and she tried to do it once, and then she's pretty disappointed that it didn't work. So, what would you tell this mother?
Yes. So that happens a lot. As a lactation consultant, I hear that question that my baby is not pooping regularly. One of the things to remember is that we want to make sure that the baby is getting adequate food. So
Yeah.
if the baby are well and they're not, eliminating, then that's a whole different, concern than a baby that's not nursing well and then not eliminating, right? So first of all, I would want to make sure that the baby is getting enough calories and food. And secondly, I would say that, like with anything, if you are wanting to get their bowels to be regular, or you are wanting to help your baby with, say, gas pains, um,
Hmm.
there will be, like you said, there will be many people, so-called baby experts, including myself, who will tell you, oh, do this, do that, do this probiotic, do this gripe water, do this. But I tell parents that, first of all, we need to listen to our own gut. Like, what is your gut telling you? Because
Hmm.
most of the time the gut is right on spot. Like, what is your
Yeah.
own maternal, paternal, parental instinct is telling you, right?
Hmm.
And
Hmm.
uh, that gets shunned a lot of the times after birth.
Hmm.
That
Hmm.
And so they say, no, I think they're in pain. And they truly are in pain if the parent is telling me that they're in pain.
Yes.
Pain may not be as a textbook pain, as we say, but it's still happening, and the parent is dysregulated because the baby is dysregulated due to the pain or the gas, right? So I say that if you try something once and it doesn't work, doesn't mean that it's not going to work down the road, right?
Hmm.
It's like when your baby starts eating solid foods and you give them your complimentary, okay, rice or moong dal or something, and they kind of be like, I'm just gonna spit it out. And they do that, and you're like, they didn't like moong dal, so I'm not gonna give it to them again ever. That's not how it works. So how do you make them? You have to taste something multiple times
Yeah.
to be like, oh yeah, now I kind of like the moong dal.
Hmm. Hmm.
Same way with the tummy massage, I say that if you are concerned about the technique, surely
Hmm.
connect with one of us. Any infant massage educator can help you with the technique piece, because sometimes YouTube will give you information, but to receive that information in person and actually see a person kind of teach you, and the amount of pressure to use and is helpful, definitely helpful, right? But again, offer it to the baby at different times,
Hmm.
and also listen to the baby. Again, the baby is crying the whole time you're doing the tummy massage, even though you are trying to help them, you really are not wanting to continue that process, because that's not bringing any
Correct.
comfort or joy to
Hmm.
you.
Hmm. Yeah, right.
So try to kind of either slow it down and see how it happens, and then sometimes you have to do something 2 or 3 times a day for you to get that confidence. You
Hmm.
that
What about sleep, Sejal? Sleep is another concern area for parents. Do you think infant massage actually helps babies to sleep better?
So I tell parents that infant massage can help their baby sleep, but not will help their baby sleep. So some babies,
Hmm.
um, if they are a baby that is really highly aware of their surroundings, and you give them a massage, it's like, okay, it's playtime. And if you do that at night
Hmm.
and sleep,
Hmm.
then I'm gonna play till 3 in the morning now, just because I'm like energized by the massage. And then there are some babies who feel like, oh yeah, this is so relaxing, I'm gonna fall asleep. So I choose your time, experiment with different times of day and choose your time, right? That okay,
Hmm.
the time when I feel like my baby will accept the massage,
Hmm.
stay asleep. So I say, do it at a time. It's like drinking coffee or tea with something with caffeine in it. I say to new parents that you want to drink coffee, you are used to drinking 3 cups a day, sure that you are drinking it away from the baby's feeding time a little bit, because
Yeah,
don't
exactly.
with caffeine and then they won't sleep and you'll be like, why are they not sleeping, right? So
Hmm.
can help with sleep, but massage can be relaxing, but it can also be active.
Yeah. So it depends on your baby and the time of the day, I guess.
They
All
are,
right.
there is no one size fits all when it,
Hmm. Hmm. Hmm.
it's all about listening to the babies. And once we start listening to them, as they grow, they will listen to us. The problem is that we don't listen to them when they're little, and then we expect us when they are growing. We are like, why are
Yeah.
you listening to me?
Correct. Exactly. So most of us have massaged our babies just because we enjoyed it and the babies did too.
Yeah.
So is there like any scientific evidence, Sejal, behind the benefits that we are talking about? Have there been any studies which show that yes, massage does this and things like that?
Yes, there are many, many massage studies. And if you go to the Touch Institute website,
Mm.
Dr. Tiffany Field has done intensive research on the benefits of massage for premature infants,
Yeah.
and even just stroking them when they
Mm.
their NICUs, they were just being stroked by their parents, and that actually helped them gain weight. So
Mm.
that is the power of the parents' touch. And what I want to remember, or want people to remember, is that you have a lot of power in the hands that Mother Nature has given us, and so we need to use that power to um, the benefit of our own mind and the benefit of your baby, right? So
Yeah. Yeah.
again, like a computer, it's constantly informing your brain about your baby's body when you massage them. So it's a sensory motor neuron where you're sensing and then you're doing. And it's a give and take between the baby and the parent of giving, receiving. The joy that you receive, the oxytocin that you get, the boost
Exactly.
you get from massaging your baby. And then eventually, there comes a time when they give you a big smile and your face lights up like, oh my, smiled at me. So
Yeah.
the thing that, that will come, but you have to start slow, take your time, and shun the voices around you, but just focus that this is my
Mm.
time with my baby,
Yeah.
and I'm going to protect that time.
I think that's super important. And I think massage in the NICU is one way for the parents to empower themselves to build some kind of connection and feel that, what they do is
Yeah,
also helping baby. So I think it's beneficial in that way.
absolutely.
So when you're massaging, do you do it in silence or is there some kind of a give and take? Do you sing? Do you tell parents to sing? Is there something that you encourage them to do?
Right. So, yes, I do. Some parents who come to my classes are very quiet and they really feel conscious about singing. So, what I usually do when I'm teaching, I give them, um, I have made up some songs of the strokes that I use, and that
Hmm.
remember the strokes as well as do them. And then that's kind of like, okay, if I don't know anything, I'm going to just use these songs. And then sometimes I will have dads in my class who will be like, well, I don't know how to sing. And I'm like, okay, don't have to sing. You can read the news to your baby. You can tell them about the cricket game you're watching and the score. They don't care. They just want to hear your,
Yeah.
because your
Yeah.
is what they want to hear. That's the music to them, right?
Mm.
So the music,
Yeah.
the parents' voice, because that's what they heard in the womb
Mm.
over and over.
Exactly.
That's what brings
Exactly.
you. And if you can't do anything, you can just hum. Humming is a
Mm.
way to calm our own nervous system,
Yes.
calm the baby.
Yes.
So why do we have the word om?
Mm.
You can say,
Exactly.
don't have to have a song necessarily.
Mm.
Um,
Mm.
more about how you are. Again, it's about how you are versus what you are doing.
Exactly.
How you
Yeah. Right.
matters more than what kind of strokes you are using.
Mm.
Did that answer?
Yeah. That. Yes. That makes a lot of sense.
Okay.
So we had some questions coming in for this live. One was, what if the weather outside is cold and my baby has a cold? Can I massage?
Absolutely. So you can massage your baby even when they have a cold, and if the weather outside is cold, you can use a space heater. And
Mm.
can just what you would want to do is, if you don't have a space heater, so here in the US we have like central heating, so the temperature is kind of regulated by the thermostat per se. But if I grew up in India, so we didn't have thermostats, and we had to make do with what we had. So what we would do is we would have like wool blankets under the baby, and then we would cover the part of the baby on their body that was not being massaged. You don't necessarily
Mm.
have to make them completely naked to get a massage.
Correct.
So if you're doing
Mm.
the legs, you can cover the rest of the body parts, with
Yeah.
a soft blanket. And usually, in if you keep the room closed and windows closed, the draft doesn't get to them, right? So because
Mm.
are worried about, okay, the cold wind will get to the baby or the new mother and they will get sick or cold. um,
Mm.
that is a concern, but as long as the baby is with you and you are protecting the baby, nothing's going to happen to the baby. In fact, the lymphatic systems of the baby will work better to eliminate any toxins or any cold, kind of mucus or whatever they have. It will be able to get rid of it by the act of massage, right?
Oh, okay. Yeah.
Want to make,
So, correct.
go
So, a
ahead.
lot of babies, so now it's a season for colds and coughs here in India, and a lot of little ones who get it have these kind of blocked, sniffly noses for ages.
Yeah.
Do you have any kind of a massage routine to relieve the blocked noses, Sejal? And if you can just demonstrate to us.
Yeah, so if they're like babies, I usually say do lots of tummy time with them, and
Mm.
cavity itself will help drain those, drain the nasal cavity and help them kind of clear a lot of the nasal passages. If they are older kiddos who are already walking and you want to do a massage, you can do this on babies as well. You can start just at the bridge of the nose here, and I'm just going to do it on my face because I don't have
Yeah.
a all with me right now,
Mm.
and go up. And the frontal sinuses are not developed in infants and babies, so you just go up to the middle of the forehead, come down and out under the cheekbones.
Mm.
So that is one way to kind of help your baby, just kind of clear sinuses, the sinus massage.
Mm.
You can also start here. A lot of the times, we clench our jaws when we have a cold.
Yeah. 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 Yeah.
Massaging the jawline very gently. And you can, babies' faces are tiny, so usually 2 fingers or 1 finger is enough depending on the age of your baby. And then going behind the ears,
Mm.
both sides, and then coming forward because there's a lot of lymph nodes right here.
Yes.
Gonna get that going. You can also, for an older child, you can also massage here. So
Okay.
you
Down.
you
Mm.
have to practice this on your own face and body to see how you feel.
Hmm.
Tell parents that see how you feel on your own face, and then think about doing half the pressure that you use on your
Yeah.
adult for your baby.
Okay. And anything for teething? That's another area of concern and cranky babies. Is there
Right.
anything you advise parents to do?
So for teething, you can just kind of have your wash your hands, have clean fingers always, and then just massage their gums. And they like
Mm.
a lot of nice firm pressure on their gums when they're teething. But it almost feels like an irritation to them, is my guess.
Mm. Mm.
But I look at their face and I say, okay, where do you? And usually they will actually guide your finger to where to go for the gum with
Relief. Yeah.
them, and they'll be like, no, 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 here, or here. Hey, we're gonna go there. So
Okay.
that's important to, again, they are to tell you where to go. And
Mm. Mm.
when you go to the right side versus the left side, they kind of like crunch up their face and be like, I don't like this. Oh, yeah. Oh, I can chew all the way here. I'm having fun here. Things like that.
Yeah. So another question was, if they are learning to massage their baby right now, who's a month old, how
Mhm.
long can they continue? Until what age?
So I used massage for my kids till they were 3.
Mm.
They were done, and then they were like, no, I don't want massage. But then they would be like, once a week, we'll handle once a week,
Okay.
because they are busy at
Mm.
years old. They don't want to sit down and have a full 30 massage. But if I can get just, okay, maybe I'll do some scalp massage, okay, maybe I'll do some leg massage, then I'll just sneak in here and there whenever I can.
Mm.
So the
Mm.
1 month old will be fine, and you can do it for as long as it makes you and the baby happy.
Correct. And I think you can adapt the massage as they grow older
They
to how
do.
much they allow you to do and when they allow you to do
Yes,
it.
you can.
So, yeah. So, in all these years of experience with infant massage, Sejal, is there any child or parent or event that kind of sticks in your memory and that you would like to share with us? Any story that you can think of?
Yes. One that sticks to my mind is, I had a family whose baby, um, she was much older. She was like about 8 or 9 months old when they started coming to the massage class. And she had Down syndrome, and
Hmm.
parent was really interested in learning massage. And um, you know, at 9 months, they're kind of learning to stand up, holding on to objects.
Hmm.
So
Hmm.
she took the class, and then eventually after a few months, she just texted me, said, Sejal, um, now my daughter has started walking, and
Oh, okay.
she wants a massage. She'll bring the bottle of oil to me. She knows where I keep the bottle of
So good. Okay.
oil in
Hmm.
front of me, and she loves it.
Yeah, that's such a wonderful story.
It just brought me
Yeah.
joy that, okay, that whatever work we are doing with these parents is making a difference to babies, and not
Mm, exactly. That's such a lovely story.
yes. and it,
And yeah,
and it was the
tell
same.
me, you will.
It was the same. It's like, that what makes your job as an educator much rewarding. um
Mm,
Not just hear these stories, but when you see that joy and that communication,
mm,
parent and the baby, that give and take, that,
that's so good.
yeah.
So, in all these years of massage, starting in India as a child and observing your sisters getting massaged and becoming a mother yourself and massaging your babies, to now educating other parents about massage on a worldwide platform. What is that one learning that you have carried with you, Sejal, and that you would like all new parents today to know?
um just that, you know we really want to be creating um awareness. And
Mm,
babies are all about the present moment. They don't have an
exactly.
going in the future or remembering the past. And I think
Hmm.
time I feel overwhelmed, I have to be like, if I was a baby, what would I be thinking right now? That's one of my ways to manage my own stress is like be in the moment.
Yeah. That is, yeah.
Because we live in a very
Yeah.
fast-paced world that requires so many of our own resources being used in many different places. We are parent, we are business women, we are employees, employers, so many things, right? But what we want to remember is that come back to the present moment and do what you can in the present moment and then go from there.
That is such a wonderful learning. And I think not just in infant massage, but in life,
Yeah.
in every facet of life.
Yes.
Okay, so it was really wonderful talking to you, Sejal, today. And I think we kind of understood why you said the skin was the brain on the outside. Because when parents use gentle, informed touch, it's a direct pathway in which they can help to grow their baby's brain.
Absolutely.
So, thank you for sharing all your wisdom and your insights. It was really good talking to you. Thank you, Sejal.
Thank
Thank you, everyone, for joining. Bye.
you.
Thank you.